two studies to present for you this afternoon. They were performed by our graduate students, and during their graduate research projects, and they are very important for us for further studies that are coming up. The first one is the validation of portable equipment for exhaled breath condensate of horses, and exhaled breath condensates a simple, non-invasive, repeatable technique to sample the airways. Studies performed in humans have shown promising results for diagnosis, as well for the follow-up of different treatment protocols measuring different biomarkers. Here I just give an example. However, in horses, it seems that there's a lot to be done yet. A few studies have been performed. One measuring pH and hydrogen peroxide of horses with lower airway and inflammation, comparing with normal horses. There was no difference between the two groups, and oxidative stress biomarkers were also investigated, as well as the assessment of the impact of collection temperature and sampler design on the measurement of the pH of these samples. There's no consensus at the moment about sampler design and temperature of collection and way to manage these samples. It seems, and I bring another option here. It started when two students of the design course of our university came to my office. They wanted to do research of their final graduation, and they wanted to work with horseshoes at that moment. And with 1 hour of conversation, I could persuade them with the idea of portable equipment that we could use in research as well as in routine for large population of horses. That was our initial idea. They did a very nice job of design that came from the problem of sedation and the invasive characteristic of the methods we usually use, and arrived at this equipment. Initially, the concept of this equipment is to be detachable with this part with a gel to be put in the refrigerator or maintained frozen, and the equipment. This concept is to put everything together just before the evaluation, and here inside there's a refill to be changed during when we evaluate many horses. Okay, and in the bottom microcentrifuge tube here for centrifugation. Okay, to collect the droplets, and in a larger image the concept of the equipment. It was interesting because this concept was awarded many design awards. Okay, so in Brazil and international events. But there was still the most important question for me, of course, it was if the equipment was able to collect biological samples from horses' airways. So we used, to answer this question, we used a prototype, and we evaluated 7 horses, different ages, from the military police of the Paraná state, from the mounted military police. And it was necessary 3 to 5 minutes to collect an amount of 500 microliters of breast condensate, and afterwards horses were sedated for BAL fluid, and this BAL fluid was processed with usual technique. Samples were maintained frozen at -20 degrees until analysis, and at this moment it was not our purpose to investigate horse in different airway conditions, but just see if we could get some information from these samples. So we analyzed the samples for protein, urea, and nitrates in them, and our results show that we have urea, we have protein in different levels here, and we have nitrates in these samples. It was not a concern to make any statistical comparison at this time. So what we conclude is that this equipment is able to obtain biological samples from horses' airways. And our next step is to involve this technique in our next studies that are just starting, one with thoroughbred racehorses with inflammatory airway disease, and another with recurrent airway obstruction horses. I'd like to thank our team and two boys, Kleber and Rodrigo, that were the students that developed this equipment, the concept of it, and the military police of Paraná State that has been a very good collaborator for our few of our studies. Thank you very much.